What if compliance could be the smartest investment you make before seeing your first patient? Today kicks off a 3-part series where Ross walks healthcare founders and CEOs through the practical roadmap for building a compliance program from day one. Drawing on nearly 30 years of industry expertise, Ross shares exactly what startups need to put in place, when to put it in place, and how to do it without breaking the bank. In part 1, you'll discover the 5 essentials every healthcare startup needs to activate, why building compliance into your DNA from the start saves time and money later, and how to create training that actually educates your team instead of just checking a box. You'll also learn how the OIG has shifted its thinking on training and what that means for your program design. This episode gives you the clarity to launch with confidence.
Welcome to the Compliance Advantage podcast. This is where healthcare executives transform compliance from a burden into a strategic asset that drives both growth and peace of mind. I'm your host, Ross Ronan, founder of Ronan Healthcare Compliance and a healthcare compliance strategist with nearly 30 years of industry experience. I'll help you stay ahead of evolving regulations while building the sustainable, compliant organization that lets you focus on high-level strategy and exceptional patient outcomes. Remember, compliance pays dividends. Invest today. Welcome back to the Compliance Advantage. Today's topic comes from multiple discussions that I've had with either CEOs or founders of healthcare companies who are in the startup mode, or they have been thinking about starting up a healthcare company, whether it's a provider group, a hospital, a behavioral health center, and really understanding what compliance has to do with essentially starting up a healthcare company. So today we're going to talk about the roadmap of what it takes to, or should take, to establish a compliance program. What phases should you establish them in as a startup is coming? Today we have our podcast producer, Cami Reyna, who's going to guide us along the roadmap to a startup.
Thanks, Ross. Kicking it off, what is the biggest mistake you see founders make when they're launching?
Compliance becomes an afterthought. Everything else gets established and set up before you start thinking about, how do I need to comply with all these rules and regulations that are out there? A lot of people feel, and they can, it's really easy to hang your shingle as a healthcare provider and start making money. It's really easy to start seeing patients, start billing the federal healthcare programs and receiving money coming in. What they don't understand is that healthcare is one of the top 3 or 4 most regulated industries in this country. And there's a lot of rules and regulations and statutes that go along with everything that you do to make money in healthcare. So thinking about compliance as an afterthought, it should be in the top 3 to 4 different departments that you're putting into place. I've met with a lot of CEOs who've done compliance at a very big company level. And I can tell right off the bat when they start a new job or they start a new position as CEO or a board member. And when they call me and they go, hey, I need a compliance program, help me get it started. I know for a fact that they're taking it seriously and they've been through the ringers. Usually they've had something happen to them, or they just understand it and how it works. And so thinking about, obviously you need operations first and you need to be able to have business and make money and do all those things. But thinking about it being the next phase of how do I keep that money and how do I keep the compliance program in play and effective is really important. Additionally, when you're talking about staffing up and staffing out and doing enrollments and in Medicare or Medicaid and hiring people with advice and guidance from compliance, because there's lots of different things that can go into place when you're hiring those people, when you're establishing an RCM program, when you're looking at documentation from the providers. There's a lot of guidance and advice and support that a compliance department could be giving a startup to make sure that they do it right so they don't have to undo it later. Compliance from the beginning sets and establishes the DNA within the organization that we are going to do things a certain way. And then you don't have to go back and fix it later. These systems, these habits, these cultures that go into place, do them right off the bat, and you don't have to change anything later.
You mentioned when a healthcare startup should start thinking about compliance, and that's before the first patient?
Idealistically, yes, but absolutely no one's going to do that. You have to have money to pay people to be able to do these things. Understanding before you start making money, before you start seeing patients, to be able to put in all the infrastructure that you need. We've had a few clients who've had investments and they've put the compliance program in place beforehand. And it's obviously the essentials, the basic minimum of what you need, because there's nothing really to do with that compliance program until you have patients, right? Otherwise, it just kind of sits there because the compliance program has to live and it has to breathe, which means that it has to do something. It's not a bookshelf program. If it's a bookshelf program, I write everything down, I stick it on the bookshelf, I grab it when something goes wrong. It's not a compliance program. That's a bookshelf compliance program, right? That doesn't make any sense. So without patience, compliance program can't do anything. With that said, there can be a very limited number of things that you do with one or two patients or even before the patients occur, which is setting up those essentials. And those essentials are code of conduct, policies and procedures, an auditing and monitoring program that you're ready to go. And obviously you're not going to do auditing and monitoring. Sanctions checking is screening. You do that with your hiring people. So that makes it nice and easy on a startup. You can begin with those. But absolutely setting up that foundation of the essentials even before you see the first patient is okay to be able to do that or very shortly thereafter. If you start seeing patients, your risk level starts to increase. And from that day until the day you actually have a compliance program in place, living and breathing, doing stuff by auditing and monitoring and testing and looking under rocks, you're building your risk, right? So as a startup, you really have to understand how long you're willing to take that risk before it becomes a problem. You got to pay providers, staff, maybe make some money at the end of the day, and that's exactly what everybody wants. But you want to make sure that you're not giving all that back or getting in trouble. We see it on the OIG investigations where someone will just go hang their hat, do everything absolutely wrong, maybe even fraudulently bill for patients they didn't see or under providers that don't work for them, or make lots of money, and a year or two later, doors are shut, they're in jail, they'll never work in healthcare again, and essentially your life is over, right? And it can happen all that quickly without a compliance program in place providing that oversight. You want to go back in and establish a compliance program. Retrofitting it back into what you've already established is a little bit more difficult than having it be on the ground up. Before the first patient, great. If you could do it shortly thereafter to limit your risk, would be my suggestion. And just doing the essentials and basics, and it's not really that expensive.
As you have talked about in some of our other episodes that we just did, let's look at things a little practically now. What are the 5 absolute must-haves for a healthcare startup?
When you're starting up, again, talking about, are we able to have this compliance program do something, right? Do we have patients to audit and monitor? If you're before that time period, right, it's a great opportunity to set up your practice standards, code of conduct, and your policies and procedures. It's easy. You put them together. There's a basic core set of compliance and HIPAA policies that need to happen. And technically, you probably should do your HIPAA and compliance policies and procedures before anybody start seeing patients and start handling protected healthcare information. Put those into place. Really, once you have those policies and procedures in place, train your staff on them. The code of conduct is what shall do and not do, right? And the policies and procedures are how you should do them or not. And training staff and your providers on what these things are is your responsibility as a CEO and a healthcare company leader to make sure that people do know what they can and can't do. So training actually lets them do that. And acknowledgments that they will abide by and ensure they are going to protect the company from violations of law, violations of regulation, patient-protected healthcare information. They're going to be able to make sure that the company complies with that. Also, opening up the clear reporting mechanisms, a hotline of some sort. Now, you don't have to go out and spend a fortune to do it. You can do an anonymous 1-800 number. There's lots of places that do it. Google has them. Microsoft Teams has them. The idea is to be able to provide an anonymous source for someone to report a mechanism for something to happen. And that's open doors. Yes, open lines of communication is one of the elements. Without that, employees, contractors, vendors, providers don't feel like they have a voice to express when they have a concern about something. Set that up early. Designate the right compliance oversight. Somebody has to be able to be in charge of this. It can be somebody that's within the organization. That's perfectly fine. You just got to make sure that they're not really part of operations, financial systems, or the general counsel, because there's conflicts of interest. So having somebody tap them on the shoulder, whether it's human resources, risk management, quality, they can do compliance as well. Just make sure that they actually know what they're doing. Make sure that somebody is actually recording the information that comes into the compliance program with your compliance matters logs and your issues that come up. Without having that case management system, whether it's an Excel file or a big program, without having that, then there's no proof or evidence of anything that you've ever done, nor can you actually track and trend situations that are happening that you need to go mitigate and prevent.
Let's break those down one by one, starting with the code of conduct and core policies. What does it actually look like for a startup?
It's really what you can and can't do as an employee of an organization. Code of conduct is really about complying with federal and state regulations in the healthcare world. Most people who work for a healthcare company don't know all the regulations and rules. They just don't. When I was a nurse and I was running around saving people's lives, putting in IVs and doing all the things that we did as nurses and coding people when we need to, I couldn't even have told you, this was before HIPAA, but I couldn't even have told you what the False Claims Act was. I couldn't even have told you what Stark was or the anti-kickback statute was. Stark probably wasn't around either. But either way, I didn't even know what those things were as a nurse because I was putting my head down and I was doing what I needed to do, which was save people's lives and provide great nursing care. And by the way, as clinicians, they don't teach you that stuff in school. They don't teach you that in medical school. They don't teach you that in nursing school. I wish it did. I used to be an adjunct professor at Regis University teaching the healthcare professionals about compliance, but it was kind of this elective course. And they just don't teach you those kind of things. So having a code of conduct along with policies and procedures are educating those individuals on what they should and shouldn't do within the organization so they don't have to go out and read the False Claims Act or get a lawyer to understand it. They get to read it in plain language and say, ooh, I can't do this. Ooh, I shouldn't do that because the laws don't let me do those things. So that's really what the code of conduct and the policies and procedures are educating the individuals within the workforce or within the people that within the company to be able to say, all right, here's your boundaries. If you see anything that's wrong, let us know. And if you come across a situation, don't do it. And so that's why it's so important to have those code of conduct and policies and procedures ready to go right off the bat.
That's so interesting. They don't teach that as part of the curriculum as required.
They don't.
Crazy. Okay, so what about training? How much training does a startup really need?
Training's an interesting thought process when it comes to compliance. When I think about the first corporate integrity agreements that we had to deal with and we had to go and implement back in late 90s and early 2000s, a lot of the requirements by the OIG under corporate integrity agreements were training and education because they went through the 7 elements, right? You had to implement all the 7 elements under the CIA. One of those is training and education. And back in the day, they used to say, 1 hour of training and education on compliance, 1 hour on HIPAA. Board training is 2 hours every year. And they'd always put hours. They always put hours, you have to do these things. And then over the last probably decade, they started changing how they look at training and education. And they started looking at it by saying, hey, submit a training plan to us of how you're going to train your workforce, your provider groups, your boards for us to approve, and we'll sign off on that. And I thought that was really an ingenious way for the OIG to come about the training and education because we always heard over and over again, God, it's an hour-long training, and we would make it an hour. Like start, stop. You couldn't start and stop. You'd have to start it over again. You had to spend 1 hour doing it. And what does everybody do when they get training like that? What's the first thing that they do?
I don't know.
Yeah, you do. Think about it. If you had to do an hour's worth of training you didn't give a shit about, what would you do?
Start clicking through stuff, press play, and then did other things.
Exactly. That's exactly right. And that's what everybody does with compliance training. That's not training, and that's not education. So when the OIG says we want a new training plan from everybody under corporate integrity agreements, what they really are saying is, tell me how you're going to educate people. So as a startup, when you think about training and education, and you have a really good compliance oversight and lead or someone guiding you down the right road, the first thing that they should be saying to you is, I don't care about hours. I don't care if it takes you 5 minutes. I don't care if it takes you 2 hours. I care that you know what you're talking about. I care that you can have a knowledge base of what the False Claims Act means, of what Stark means, of what you can and you can't do under each one of these things. And if you know it, and if you studied it and you can figure it out, and it takes you 5 minutes to do the training, and you're doing interactive, and you're like, click, and I answer all these questions, I'm good, testing out, that's education and training, in my opinion. So don't go spend a lot of money to sit there and go, I need an hour's worth of training, or I need 2 hours worth of training, I need to do this. Find a way to create an educational system for your providers and your people so people learn. Whether that's a quick PowerPoint with an answer, Q&A, do pre-testing if they need to before they do training to say, oh, you hit 80% of this, you don't have to take training because you showed proficiency. But as long as you're doing training on your policies and procedures, code of conduct, relevant laws, your compliance program, and you're getting that information out there, then you've actually sufficed your training requirements. And you don't need to break the bank. Interactive training programs you can put into place will be so much more effective and efficient for an organization, and they're really not that expensive, depending on how many employees you have. There are specific people doing specific things within an organization, like coding and billing. They need specialized training too, to understand what medical necessity means, split shared services for Medicare patients. They need to understand what those mean from a coding and billing perspective. OIG indicates that that's really important. About $2 million of HIPAA violations, and those can be prevented by HIPAA privacy training and making sure that information is secured. There's about 6 million plus medical records that are breached every year. And some of these provider groups, whether it's a revenue cycle company or a provider group, they have tens and tens of millions of records that have been breached. And a lot of that has to do with phishing schemes and understanding what you can do and can't do. That can be resolved by training.
Next time on the Compliance Advantage, join us for part 2 of our Healthcare Startup Compliance series. Ross digs into the dollars and cents of building a compliance program, including what to realistically budget in your first year, how to phase compliance in if you are on a tight budget, and the 1% rule that keeps your program scaling right alongside your revenue. He also shares the clear signals that tell you it's time to level up, from payer audits to multi-state expansion to preparing for investment. You will not want to miss it.
Thank you for listening to today's episode of the Compliance Advantage podcast. If you enjoyed it, please rate, review, and share this episode with someone who might benefit from it. Don't forget to visit us at ronanhc.com for more resources and connect with us on social media for the latest updates. And remember, compliance pays dividends. Invest today.